true and know what's been before. Ôi chi đi ca arugoti holy be.
Today is also the Cihsr festival of the Angamis. I want to convey my greetings to all the Angami friends who are here, including Dr. Setegi. The background of this institution has already been explained by Dr. Sedebi and Dr. Paul. So I will not go into the details of it, but from whatever little understanding I have of the healthcare sector, I can understand that this institution is one of the pivots of healthcare. We have medical personnel, we have nursing personnel, and we have paramedical personnel. So this is one of the pillars of the entire healthcare sector in the state and in the country. And I am really happy that this paramedical institute has been given the status of a regional institute. As you know, Northeast is a big area, and Nagaland is one of the smaller states in the Northeast. But having a regional institute in Nagaland is a matter of great pride for me and for all of us. Of late, a lot of development is taking place in the healthcare sector in Nagaland and in the country as a whole, but especially in Nagaland. You are aware that we recently, this year only, the medical college at Kohima was inaugurated and it has started classes. And the first batch of 100 students, all the seats were filled up, and they are currently undergoing their education. Similarly, we have another medical college which is coming up in Mon. Maybe it will take a few years, but the work is currently on. One of the other major initiative that the state government has taken is the Chief Minister's Health Insurance Scheme. I am sure you are aware of this scheme. This is one of the key initiatives of the state because it gives universal coverage of insurance to all the citizens of Nagaland. We have the national program which is called the Ayushman Bharat scheme, under which people of a certain income level are only covered. But we in Nagaland, we have covered all the uncovered people plus all the government servants under the Chief Minister's Insurance Scheme. So what has happened is that in a short time, not only the people who are covered under the scheme are benefiting, but even the hospitals, healthcare institutions, they are also benefiting by the scheme. I'm sure Cihsr also is a beneficiary of the program because now the patients don't have to pay from their pocket for the hospitalization expenses. It is the scheme which pays for it. And since even government, semi-government institutions are also covered under the scheme, they are getting the benefit. So in years to come, I feel that this will make many of the healthcare institutions, facilities more viable and sustainable, and even government facilities and semi-government facilities will benefit out of it. Our target is to provide equitable, affordable and quality healthcare for everyone. That is the target given to us by the Sustainable Development Goals vision of 2030. So we are moving in that direction, and the students, you are also part of this vision, and Cihsr, this institute, Paramedical Institute, and the students who are enrolled in the institution, they will all help us in achieving this vision. Very recently, just a few days back, we have got another approval to have a 400-bedded hospital in Kohima, which will be part of the medical college. This hospital is going to be set up by the Japanese investment agency. So it's going to be one of the state-of-the-art hospitals, not only in Nagaland, but the entire Northeast. So when we are expanding all these healthcare facilities, the demand for trained personnel is also going to go up. There is already a huge shortage in Nagaland of paramedical staff. But with growing expansion of the healthcare systems, this demand is going to grow. And when the demand grows and the supply is less, it actually translates into better incentives, better, employment conditions. So the people who are enrolling in these courses, I think they are very well placed to have a very bright future and a bright career in the years to come. Not only in Nagaland, actually, there is a huge demand across the world for healthcare professionals. Not the doctors, but paramedical professionals, the nursing professionals. We have been getting a lot of inquiries from Japan. As you know, in many countries, the lifespan of people is increasing. People are living longer. So their healthcare needs actually, they are growing, whereas their population perhaps is not growing as much. So that is leading to a lot of demand for healthcare professionals. And in some countries, developed countries, the working conditions are good, the income levels are good, but they require a certain amount of proficiency in the field that you are in, and they also require proficiency in the language of that country. So keeping that in view, in fact, the government of Nagaland has started a Center for East Asian Languages in Nagaland University, and we are going to start teaching Japanese language to people who are willing to take. So I'll actually encourage the students here to think about learning one of these foreign languages. You may not eventually go to Japan, but learning an additional language is never going to be a bad investment. The Japanese are very active in this country also. So if you know the language, it's going to be of great help to you. But this is a secondary issue. The main issue is how do you maintain excellence in your studies and your skills. I am so happy to learn from Dr. Sedevi that this institution is one of the best in the Northeast, and the students who
start the inception of the Northeast Regional Multidisciplinary Paramedical Institute, the NERMPI. And as we gather together to celebrate the inception of this day. This is a testament not only to our academic achievements, but also to Cihsr's unwavering commitment in the excellence of healthcare education in Nagaland. I just look back to the journey of Cihsr in health sciences education. I'm reminded of the modest beginning in the year 2011. The Diploma in Radio Diagnostic Technology was started with the Christian Medical Association of India. I also played a small part in that. I was the convener of the Medical Radiation Technology Training Committee of the CMA at that time. Least I thought a decade later I will be in the same institute and be there for the inception of the college. Subsequent years, we saw further development. We had the medical records training program started, and also in 2014 the laboratory technology training program, both under the Christian Medical Association of India. Another milestone was in 2019 when these courses were upgraded to bachelor's program with the University of Nagaland. Particularly the medical records technology became hospital information management bachelor's program, and the laboratory, BSc laboratory technology, both were converted to BSc programs under the Nagaland University. And in addition, we also started the Operation Theatre and Anesthesia and Operation Theatre Technology program the same year. This was a major shift to the way we were doing the health sciences education.
Network, national and international network of people who he gathered together and put this together. And you know, his network with Dr. Paul and CMA in those days. And then after after that, Dr. Jacob came in. So Dr. Jacob Chaco then took charge because our hospital, our institute was expanding. So Dr. Jacob Chaco came in, and then he's actually a pediatric surgeon, and he also retired as the head of department in CMC Vellore. Then he took on this job of fostering these programs, all these programs, and he put a fantastic amount of effort. And Dr. Jacob and several other of our staff, they really went beyond their call of duty to actually study new subjects which were not their own subjects, to be able to teach the students, like pathology or biochemistry and several other things. And that really, it took a phenomenal amount of work and effort. So generally, a surgeon's or a physician's work will finish around 7, 8 or 9 p.m. Every day. And after that, then they would start working on this so that they could teach the students. And after Dr. Jacob went, and Dr. Simpson, who again set up the Department of Developmental Pediatrics in Vellore. It's called Nambika Nilayam. He worked for 30 years there, retired, came, and then he took over and continued to foster all these programs. All these were outside their actual area of work. So a lot of people have really put in their heart and soul to do things which they were not originally designed to do, but they felt that there was a need, and there's a need here in the state and region, and they felt called to do this. So we are really extremely grateful to God for providing these key people, who came in just at the right time and brought this all together. So we're hoping that the Paramedical or Allied Health Sciences College will really fulfill a need of the state and the region. And we're looking at not just producing courses for the sake of it, but to see and identify what are the needs in Nagaland. What are the areas of need? We know that there are a lot of ICUs, there are not enough ICUs in Nagaland. So there has to be more ICUs. But who's going to man the ICUs? The nurses alone won't be able to manage. So we need to have critical care technologists. We need a lot of, in the long run, maybe even pharmacy college. Nagaland is really suffering from lack of good pharmacists. We need to create more pharmacists, and then radiographers, and several other technical people who are badly needed across the state. And we hope that we can generate the manpower for all these areas and network, and not just place them there, but support and network with them, so that maybe at least in the 10 years time, Nagaland should look very different. At least the health infrastructure and the manpower in the scene should look completely different from what it is currently. Now, I know that the government is working very hard towards many areas, and I feel that we can partner with them in all these areas. So that's the reason why we exist here. We're not here to just create a nice college where we think we're doing a nice job, but we really are here so that we can partner and impact the health in our state. As far as the way forward is concerned, we have a 5-year strategic plan every 5 years, and we've just finished one. And we're looking, I'm just trying to challenge our staff and say, can we look at a time that, maybe 10 years down the line, where a single patient will not need to go outside Nagaland unless it's their own choice. They want some 5-star facility in Delhi, that's fine. That we may not be able to generate, but at least reasonable care, so that they should not say this facility was not available in Nagaland and so we had to move out. And if that's something which we can dream and work towards, I think that we would have fulfilled the purpose and reason why we're here. We're looking at an integrated center for disability. We would like to network with several organizations in the state and region for primary care, secondary care, and we'd like to work with other hospitals to enable them to acquire best practices. We might need to have a transplant center, that means a kidney, liver, bone marrow transplant, a research center which can look at all the health needs of our state, and then a teaching and a training center. So currently we're developing a simulations lab from our own resources, whereby we can get all the other nurses and nursing schools and colleges to come and use it and improve the standards of nursing in our state. Currently, we already have a lot of nursing schools and all coming and using our facilities. So, like Dimapur, they come here for about 2 months in ICU, things like that. So we would like to increase this partnership so that these resources are not confined only to this college, but to this institute, but for the whole state. And that's something which we would like to share and network. We can, maybe sometime down the line, if we can get a medical college and maybe even a university where we can move even faster. So those are some of the activities that we've been doing and some of the dreams that we would have for the future. And we're very grateful once again to the government, our Chief Secretary, our Development Commissioner, people in the health department, and all the people who've been really working to support us and partner with us with the common goal of providing health that our people so much so deserve. So thank you once again, sir, and for all our guests who've come here to be with us on this occasion.
Nagaland TV, Sob Manulaga Awas. Watch us live on Geo TV and on your television sets as well. For Dimapur viewers, we are on channel number 994 in Global Chapter, and Kohima and Mokokchung viewers, switch to channel number 138 on Hornbill Digital. For all news and updates, follow us on Facebook, Instagram, YouTube, and Twitter.